I'm Greg McDonald and I'm the Director of Emergency Care, and I'm now just been appointed as the head of the division of acute and primary care as well. Syncope, most people would consider fainting or blacking out, and the classic story of syncope is your blood pressure falls, you reduce the blood flow to your brain, and then three things happen. You lose consciousness, you drop or slump because you can no longer maintain your posture. When your head's down, you restore the blood supply to your brain and you wake up very quickly. So the triad of symptoms is sudden loss of consciousness, loss of postural tone, biting the dust, and then waking up quickly. And most people start waking up within 20 seconds, 30 seconds or so. So that's syncope, and it needs to be distinguished from other things, seizures, falls. We see a lot of patients with falls, but the thing about a fall is you know what you've done. You know, I tripped, I remember, I tripped, I fell. And most of those patients can remember the event, they didn't lose consciousness. Sometimes it's complicated, sometimes they fall but don't know, and a lot of elderly patients say, I tripped, when they probably didn't, when they probably blacked out. The main causes of syncope, the commonest one that you would see would be what we call reflex syncope, where people have an odd reflex from the vagus nerve, which comes from the brain, to the heart, which slows the heart down and drops the blood pressure. And that happens particularly in young people from fear, from pain, from stress, the sort of thing where you're in a hospital room with somebody who's sick and you're standing there and suddenly you feel like you're going to pass out. That's that sort of reflex vasovagal syncope. There's orthostatic hypotension, which is the next most common cause, or postural hypotension. All that orthostatic means is standing up. And that occurs if you're standing up for too long. I was, say, in the cadets, I was on parade and then I fainted. That's a fairly common cause. Other causes might be older people with blood pressure problems on blood pressure medications, might be dehydrated, so they stand up for any period of time and they lose their blood pressure and faint. Also, that classic story, you get out of bed too quickly, particularly if you're older again. Your blood vessels are less sort of elastic and responsive to that change in posture. You know, they have to work hard to push the blood up to the brain when you change position. So that's the classic story of somebody, older person, getting out of bed, going to do something and passing out. The most important, and what the Syncope Clinic is really trying to find, is those sort of 10 to 20% of true syncopes that are related to a heart condition. So the heart conditions are heart rhythm disturbance, either too fast, too slow. Heart valve disturbance, particularly the aortic valve. The aortic valve is the valve that opens for the heart to pump blood out to the circulation, particularly to the brain and all the vital organs. So if that aortic valve isn't opening properly, the blood doesn't flow out properly. And so heart rhythm disturbance, aortic valve disturbance particularly. Other heart conditions, sometimes you can have a damaged, weakened heart. For a lot of conditions that might cause you to pass out. People with coronary artery disease, one of the possible symptoms of coronary artery disease is that on exercise you pass out because the heart can't pump efficiently. So somewhere around 10 to 20% of true syncope faints is related to some sort of cardiac condition, and obviously the older you are, the much more likely it is going to be related to a cardiac condition. Young people faint from, as I said, reflex things or sometimes prolonged standing. Older people tend to more likely faint from cardiac causes. And a lot of those patients are going to attend a doctor. Some of them come to an emergency department, some are going to go to a GP. It's important to work out what is going on. Emergency departments, we have the facilities, fantastic. We can have a really good go at working out what the problem is, going through all those diagnostic processes, doing the investigations, admitting half the patients, trying to sort them out. Even then, we're still often not sure. General practitioners, they can do the same thing. They're in a slightly different situation. They don't have the resources in the room, they have to refer around. And they have to make a judgment of the risk of the patient. Should they go to an emergency department? Maybe they should refer to a specialist clinic who can do all that investigation work up at the same time in the one place. But the patients have to realise that they should probably see a doctor if they've had a significant episode where they have lost consciousness and fallen to the ground. They just have to reflect on what happened, how bad that was, and maybe I should see somebody about it.